Hi, this is Colleen Parsons again with part 2 of breast assessments. The subjective information about breast assessments, of course, we're looking for any pain or tenderness, any lumps or discharge anywhere, but specifically from the nipples. We're looking for swelling, trauma, any history of breast disease, any history of surgery, and that would include enhancement, or either through breast implants or through making the breast smaller. For some reason, I can't think of the word right now. And the self-care behaviors, specifically around monthly breast exams. When was the last mammogram? And going up into the axilla, looking for lumps, tenderness, swellings, or any rashes there. Breast cancer in women. Breasts have a lot more to do for women in our Western culture than just mammary glands, unfortunately. So there is all sorts of sexual innuendos, feminine innuendos with regard to breast tissue. It's amazing, but hopefully we can have a discussion in class around that. What that means to women and how afraid they become if they find a lump. Most lumps are benign, but they breed an incredible amount of fear, anxiety, and panic in women. And breast cancer is still among the leading causes of death in women with regard to cancer. Subjective questions that you need to ask any woman, whether you're physically going to assess her breasts or not. And these questions also should be asked of men, but do you have any pain or tenderness in breasts? I want to say that it's 10% of men experience breast cancer. So when did you first notice the pain or tenderness? Is it localized or is it all over? Is there a painful spot to touch? Do you feel burning or pulling sensation? Is the pain cyclic? In other words, does it have any connection with their menstrual cycle? Is the pain brought on by any specific strenuous activity or any activity? Does it involve, do you feel the pain more often when you wear a specific bra or when you're doing a specific activity? If you are noticing a lump or they have noticed a lump, have you ever noticed a lump or a thickening in the breast tissue? Where? When did you first notice it? Those are all questions that you're going to be asking of any lump anywhere. When did you first notice it? Has it changed at all since you first noticed it? And specifically with the breast, is there any discharge from the nipple? When did you first notice that? What color is it? Does it have an odor? You can imagine the information that you can accumulate just by talking to a patient honestly and openly in a safe environment. Rashes, especially under the breast, is a big deal for women who have pendulous or large breasts, and yeast likes to grow in those warm, wet places, and under breast sweat, just like other places on our body, and for whatever reason, yeast really likes to grow there. So when did you first notice your rash? Do you have any swelling again? And if the woman is breastfeeding, you'll have a lot of different sorts of questions around that, or if she's pregnant. So trauma, has there been any trauma to the breast? History of breast disease, any history of breast disease yourself? How about in your family, particularly sisters, mothers, and maternal grandmothers? So it's the whole maternal side that seems to be much more important than the paternal side with regard to breast cancer. Have you ever had any surgery or radiation? What medications are you taking? There is an increased risk of breast cancer with oral contraceptives, and other types of medications. So self-care behaviors, who taught you how to do your breast exam? That's an important piece. And do you do it regularly? And you might want to have the woman repeat it for you, demonstrate that she knows how to do her breast exam. She should be doing these monthly. It's very important to do them monthly so that you can note any changes, and you should do them right after the end of your menses. Again, going up into the armpit, the axilla, and any history that you can give to get from pre-adolescent girls, and advice that you can give them. Have you noticed that your breasts are changing? Many girls notice, and then they think something is wrong with them, so they're not exactly sure what to do. They think they might be dying, and it's just the growing of their breast tissue. And some of these questions are really important. If a woman is planning to breastfeed, does she have a history of inverted nipples? That's going to make it a little bit harder, or quite a bit harder, to feed their breastfeed their babies. And lots of changes happen for women after menopause. So if you notice any changes in the breast contour, shapes, or firmness of your breasts, the change might not be as apparent to obese women or to women who have had earlier pregnancies, because they have already gone through a lot of breast changes. A risk profile for breast cancer, the 5-year survival rate for localized breast cancer, which means it hasn't metastasized, used to be 78% in 1940, and it's up to 98% survival rate today. If breast cancer has spread regionally, which is into the additional tissue, but still in the same area, it hasn't metastasized outside of the breast area, survival rate is down to 84%. And that's the end of part 2.